I saw a friend of mine that I'd not seen for about a year. She just looked so radiant and gorgeous. So I said, you know, your skin looks amazing. What are you using? And she told me that she'd had this treatment called Ultherapy. It's a type of ultrasound, so it's like a heat energy going into your skin. So it's quite warm and it's quite tingly. She said, I had it 3 or 4 months ago and I feel like my skin looks more radiant. And I said, you look like you've been on holiday and slept for a week. And my friend looked incredible and I thought, okay, I want a bit of that. But you can do around the brow, the neck, around the cheeks, anywhere you want to look lifted. It makes you feel better, makes you look better, and makes your skin more healthy looking.
Welcome everybody to our webinar today on Ultherapy. This is the second in our series, and it was really, we've done this today with we're very lucky to have our Ultherapy specialists to answer everybody's questions, because we were inundated after the last Ultherapy webinar. So we decided to do number 2 to answer all those outstanding questions for you. The way the webinar is going to run is I'm just going to very quickly run through the way Ultherapy works, what it does, how it all happens. And that will be very, very brief, just a few moments of recap. And then we're going to go swiftly on with our Ultherapy specialists, answering as many questions we can in this 14-minute session. It will be very pacey. We'll work through as many questions as I've said, and then if you have any outstanding questions, you can always send them in to us, and we will endeavour to answer any more. Our clinics are open to have consultations, and they are complimentary consultations, and we'd be very happy to see you in person in our clinics. Next slide, please. So just a brief recap. My name is Dr. Tracy Mountford. We are at the Cosmetic Skin Clinic, and we have a number of clinics all over the country with a multidisciplinary team of doctors, nurses and Ultherapy specialists. To date, we performed over 6,000 Ultherapy treatments. So we're, as I said, we're very, very lucky today, because I have the UK's probably most experienced Ultherapy practitioners to answer the questions, and we are a centre of excellence in the UK for this technology, because we've embraced it, we know how to use it, and we know how to get best results from it. Next slide, please. And here are the people that matter in clinic, and I've got these 3 people online today who are going to be there with all their wealth of experience. And I personally feel that at the end of this webinar, everybody will go away feeling they know so much more about Ultherapy, and will dispel a lot of myths as well. Next slide, please. So what is it? A very, very quick recap, because on the first webinar, this was all discussed. Ultherapy is a way of non-surgically skin lifting and tightening the skin on the face and body. It's FDA cleared, and to date there have been 1.75 million Ultherapy procedures performed globally. So it's a very, very well recognized gold standard skin tightening and lifting treatment. Next slide, please. Why does it appeal to people? Because it is truly non-invasive. There's no downtime, no surgery, and no needles, and it's performed in a very brief procedure. I mean, 60 to 90 minutes maximum as a single treatment, which we'll be discussing more in a moment. It gives long-lasting results, and it really is filling a gap for people who want to embrace something that harnesses their own collagen, stimulates and lifts the skin, but doesn't leave scarring or any telltale signs of anything being done. Next slide, please. And why and how does it work? It uses a very clever technology called, it's using micro-focused ultrasound with visualization. And what that basically means, we can actually see the areas we're treating. We're going to show you later how the technology works. So the practitioners will explain how they actually can target the areas that they need to target to tighten and lift, even as deep as muscle level. And therefore we can get predictable, long-term, really pleasing outcomes. We can actually target the same level that surgeons work on when they perform a surgical facelift. So it's a very, very exciting piece of technology. Next slide, please. And this next slide, after this, somebody asked us, Sal said, how does it work? So we're just going to recap on that with a video. So if we can just roll that video, please.
With age, skin loses its elasticity and the signs of aging become more visible. Beneath the skin's surface, structural proteins such as collagen decrease over time. This leads to a decrease in skin's elasticity and contributes to sagging and the forming of wrinkles. Ultherapy is a non-invasive way to lift and tighten skin and is US FDA cleared and EU CE mark certified. Using microfocused ultrasound along with its proprietary deep sea ultrasound visualization, Ultherapy delivers energy to where it will be most beneficial, leading to a lift and tightening of the face, neck and décolletage. During an Ultherapy treatment, ultrasound waves are microfocused at precise depths in the dermis and hypodermis, sparing the skin surface and intervening tissue. Friction heats the tissue to between 60 and 70 degrees Celsius, forming thermal coagulation points at depths of 1.5, 3 or 4.5 millimeters. Delivery of ultrasound energy in this manner causes contraction and denaturation of collagen and initiates the body's healing response, resulting in collagen and elastin synthesis and tissue repair. This new collagen growth leads to skin lifting and tightening that gradually takes place over time, with visible improvements that can even be seen a year after treatment. Ultherapy is scientifically proven to stimulate new collagen and elastin, which can reverse the signs of aging in the face, neck and décolletage.
Okay, that's just a very brief potted history of what Ultherapy does. So we're going to get straight into the questions now, so and keep the pace going so that everybody can get as much information as they want. So Mandy sent in a question, and I'm going to ask Tara this. She's been reading a lot about skin tightening treatments, and there is confusion generally for people with the difference between something called HIFU and Ultherapy. In a nutshell, Tara, can you explain what the difference is, please?
Yeah, sure. So Ultherapy is gold standard, FDA approved. HIFU isn't. That's as simple as that. So when it's been through the toughest approval board in the world, it is clinically proven to stimulate collagen. Also with HIFU, you're not seeing the visualization. So I'm not actually seeing your collagen. So you're treating blind. Now, as we don't inject blind, as injectors, we also don't treat the skin tightening. So that's as simple as that. It's not FDA approved and you cannot visualize where your collagen is.
Yeah, so what we're saying is, I suppose what we know when we use Ultherapy in clinic is that because we can see the area to treat, we're going to get more predictable outcomes. That would be the
it's all about the visualization. So you can actually target where your collagen. Otherwise, you are just treating blind and not having such an effective treatment.
Yeah, and I think when I hear some of the practitioners saying, I think I might have heard you say it before, is that it's a bit like driving with a blindfold on, and that's what the campaign said. If you can't actually see what you're treating, you can't get the result, can you? So, in a nutshell, that's what that is. Thank you, Tara. And next slide, please. So we're just going to show what areas can be treated with Ultherapy, and then we are going to discuss it. So very briefly, can we put that on the next slide, please, on the screen? So Lee, can you just talk to us about the most popular areas, perhaps? And I know you guys all treat the same areas, really, but this shows this is a holistic treatment, really. It can be used to treat a brow lift, the lower face, the décolletage, the body. Lee, what's the most popular area, do you think, when you see a patient and consult them? What do they want done?
Sure, yeah, many of the patients that come in and we consult with, they're all looking to have their sort of lower face treated, and then the upper neck, especially the submandible area where they want to treat and tighten this little bit that becomes a little bit loose under there. But then other popular areas are brow lifts as well as all the neck tightening. Yeah.
And Sylvia, I think I saw a patient in clinic the other day. You you've done something on their décolletage, I think. Do you treat, particularly this time of year, is that a popular treatment? Yeah, and do you get good results there? Because that's something we're asked quite a lot.
We absolutely can treat décolletage as well. It is popular area to treat. We've got specific layers that we can target to achieve the best results in the décolletage area. So yes, absolutely, the answer is yes.
Yeah, and I can understand that, because, and with brow lifts, Tara, I noticed again, I know eyelid lifts are very popular surgically, but a lot of people don't want a lid lift. So do you use Ultherapy to give that sort of lid refresh?
Yeah, totally. So particularly for those patients who are wanting to prevent a sort of skin laxing of droopy brow. So it's all really about prevention around the brow. So I love it when patients start talking, that they would like some in their 40s. If they start talking about skin tightening, we know they're going to prevent that brow from feeling heavy as they get older.
Yeah, no, that is, and I think that's what we all love about the versatility of it. We can target certain areas, or we can do this holistic approach where we can do everything. So I think this is the beauty of Ultherapy. Next slide, please. Okay, so the results that we're likely to see, I'm going to whip through some befores and afters as well, because it is quite important, but also what we can't, because Sue was asking about this, what results am I likely to see from Ultherapy? And there's a lot that we can see. If we just go on to the next slide, I'll allow you guys to elaborate on this, because we know how it works by regenerating and harnessing our own collagen and elastin by tightening in, as we've seen on those videos. But there is no doubt it's not just the lifting benefit and treating the sagging and drooping, but it's also the improvement in skin quality as well. So again, I'm going to keep with you, Tara. Are people mainly after lift, or are they mainly after improvement in skin quality?
I think it's a combination of both. It also depends on patients' ages. So sort of often as we get older, we're concerned about the heaviness along our jawline. We're looking for more of a defined jawline. So, but also those patients who had a lot of sun exposure over the years, and it's all about those little fine lines. So it can be a combination of both. But generally, I would say most people's concerns as you go through the menopause is skin laxity and the heaviness we find along the jawline.
Yeah. Next slide for a minute, please. Thank you. That really answers it well, because Lee, again, I know you're very hot on, well, to be fair, as we are in clinic, generally skin quality is very important. There's no point having lifted skin if our skin quality is poor, because that frankly is just not addressing the issues. But I know we're looking at a brow lift treatment, but you're very keen on improving people's skin quality as well, yes. Aren't you, Lee?
Yeah.
And do you find you get decent results or good results with this treatment?
I do. When the patients come back for their reviews, they're very excited about how fresh they look, and it's not just the lift that they've got; it's the quality of their skin and the luminescence where the light just shines off of it. So it's really pleasing to see. Yeah,
and it does allow people to wear less makeup. What we're going to do is just run through a few befores and afters. We're not going to really talk over these too much because we've got so many questions. But again, I think this one just demonstrates a very nice, good lid lift from just treating the brow. Literally, by treating the brow, we can get that lovely lift on the eyelid. Next slide, please. These were in the previous webinar. So anybody who actually wants to see the previous webinar where we go into more detail about the way we treat the process, we will provide a link for that. Again, this shows a very nice jawline and an improvement in what we call as practitioners the submental area. It gives a nice contour and lift to the face, on the lower face there, beautiful lift. Next slide, please. And here, really tricky area. I think all of us, wouldn't we? We'd agree that this kind of neck is tricky, isn't it? Very hard.
Improvement of the texture, absolutely love it.
Yeah.
And Tracy, we often combine that area with a collagen stimulating, what we call a neck wash, skin booster treatment.
Yeah, which we can discuss in a minute, because that's a great one to talk about how we combine treatments to give best effect. Next slide, please. Yeah, and again, very similar, but showing actually something we'll discuss in a minute. that this treatment is just as popular with males as it is with females, because there are no telltale signs of it being done and no downtime, which is a big thing for men. They can't cover with makeup. They can't pull their hair down over their face. They want something that's easy to do, simple, and there's no downtime. Next slide, please. And again, that bandy neck, I can relate to this, sadly, but that sort of bandy neck. And I know, we would use a combination treatment, which we'll talk about in a minute with that one. Next slide. This is deliberately just recapping on the previous webinar. That almost looks like that lady's had some sort of surgical fat reducing treatment there, like lipo, but it just shows you, actually, if you can get a patient, and when we assess patients, if we get them to go sort of like this, and the actual fat pad lifts up, we can often get very, very nice results with our Ultherapy treatment. And we can talk about that later. Next slide, please. We're just whipping through these at a pace. And the last one here is the décolletage, which we touched on earlier. Really nice result. That's just Ultherapy alone, but in combination with treatments, which we are going to be discussing, we can really optimize outcomes and give quite long-lasting results, which is great. Next slide, please. Okay, here we go. On to the nitty-gritty of the presentation. So I'm going to pitch this out there. Francis says, what's the best age to have Ultherapy? I'm in my early 40s, so let's pitch that to Sylvia, and I'm going to ask all three of you to give me your top line. What's the best age to have Ultherapy?
As it said, I think across all ages. However, I wanted to mention that a few weeks ago, I treated one of my colleagues who is in her late 30s. So you would ask whether it can be treated, she can be treated, and her main area of concern was the subdental area. But the rest, the jawline looked beautiful. So yes, we can treat patients in their 30s as long as 40s and 50s and all ages categories. Yes.
Yes, that's really
as a preventative. Yes, as a preventative.
So I know you're very, very, very passionate about the preventative element as well, aren't you?
Yeah, because it's always easier to prevent than wait till we have to correct. So if we, as I said, my patients start talking about skin tightening in their 40s, get really excited, along with a combination of medical grade skincare, some skin boosters, we can really keep those patients from the sagging and the repositioning of the fat pads that tend to get as they hit menopause.
Yeah, and
so
Lee,
40 is perfect.
Yeah, well, Lee, what's the oldest patient that you would treat? Because we're talking about prevention, we're talking about catching people at the right time. But would you put a top line on the sort of age category for an Ultherapy patient, Lee?
No, not necessarily. As we've been discussing, that if patients are starting at an early time and they're preventing and they're going along their journey, there isn't any reason why the later years that you can't use Ultherapy on them. And I think it's a very nice treatment for them, because it just we can use it as a corrective procedure as well. So it's a very nice procedure to have done. Yeah. And one of the things we've got. God, sorry.
Sorry, I said, I know I've been accosted by, in a nice way, in clinic in London by, I think, one of your patients who is in her 60s. But I think you can actually, I think it's a bespoke treatment, isn't it?
Yes.
And
everyone, absolutely.
Yeah, you assess yourself. Sorry to interrupt you there. Next slide, please. Okay, who wants to answer this one? How many times do I need the treatment? Is it a course or a one-off?
It's a very simple answer. What we are suggesting to our patients is a one-off treatment. However, it depends on the age as well, how often when we will repeat the second treatment. So usually we will say to our patients it's one-off treatment, but the next treatment we can repeat in about 12 months or 18 months, depends on the age and also lifestyle.
Yeah.
And if I can add something in, yes, please. Yeah, and it depends on skin laxity as well. So if the patient has mild to moderate skin laxity, then one treatment would be good for them. But if they're just over that and they're a little bit sort of more severe laxity in the skin, then I'd say probably 2 would do them.
Yeah, again, it's a bespoke treatment, isn't
absolutely.
it? And that's where one size definitely doesn't fit all. And that's, again, the experience. And I know I keep singing everybody's praises here that's on this webinar, but it's true. I think with outcomes and clinical outcomes, it always is about that assessment, the experience of the practitioner, and that transparency with the patient of knowing exactly what will be involved to get the outcomes that a patient is, wants. It's not as simple as just doing a treatment on anybody in a certain way. It's a very bespoke treatment. That's the way I would say it. And I know all you three would say that too. I've seen the kind of complex things you all do, as well as the much more sort of not easy, but straightforward treatments. You have a whole remit, what you all do. Next slide, please. Okay, what happens on the day of treatment? We are going to play a video on this and then just elaborate on that if necessary as well. Next slide, please. Okay, could we play the video, please?
This week's Tweak of the Week is an Ultherapy brow lift.
So we're just going to mark up the areas that we're going to treat and the areas that we're going to avoid. So we're going to be targeting the muscle, but the muscle's quite shallow here. We're going to be using an ultrasound gel, if you remember. We're firing thermal coagulation points down onto the muscle to cause some contraction and lift. I can also see the bone, I can see where the muscle is and exactly where I'm applying my coagulation points or heat. And it makes it a very individualised treatment as well, because we have to assess the depth of where your muscle is, etc., and where I need to be focusing the energy. A one session only treatment, and usually you start to see results first of all around 6 weeks, whether you get some skin improvement, and then you'll get your full tightening around the 3 to 4 month mark. And then usually people will repeat this treatment 12 to 18 months. If we're talking about a pain score of 1 to 10, this is usually around a sort of 4 or 5. Sometimes a little bit pink on the skin afterwards, but that will resolve very quickly within about an hour or so.
Okay, so that just gave a really sort of potted, very, very simplistic view of what goes on in clinic. And in that video, it actually just shows, the technique. But and then they do talk about how the treatment feels, which we'll talk about in a sec, which this question is about. But can I just ask each of you, people are naturally often very nervous when they come into any practice with a view to doing treatment. What do you say to them about their journey and how it feels and the experience of Ultherapy generally? So Tara, what do you try and say to people before they come in to prepare them for their Ultherapy treatment?
I think most people are very concerned that it's going to be painful. They read a lot of that, and yeah, it's not the most comfortable treatment, but we've got really good being, the centre of excellence and doing, I think, what did we do, 1,000 last year, but with a combination of some pain relieving medication, coming in and having some numbing cream. And actually I've had, I think, have we had it about 10 years now? I can't remember.
No, a long time,
I've had about 5, and I've got a low pain threshold, and I'm always quite glad when it's over, but actually I get through it and I love the results. So
so yes,
I try to reassure them it isn't as bad as what they've read on the internet.
No. What do you find, Lee? Do you find people have an expectation of Ultherapy that that's different to what the reality is?
Yes, they do. I think going on from what Tara said, that they have read a lot about it online, and there are lots of misconceptions out there about the treatment. But it's and I explained to them after having several treatments myself that it just feels like a sort of warm sensation on their skin, and sometimes it can be a little bit sort of tedious, but it's not a painful treatment.
No, I agree, and I think that. I think there is a lot of misconception, which we'll touch on this webinar. But actually, I think with most people, they come in, they just lie there for an hour, let us do the job well, and let us get on with it. And I think I describe, with this is not a beauty treatment, as I say to patients. This is a medical treatment that works. It's not just like a facial, a little bit of this and that. This is a medical treatment that has significant lifting, long-term beneficial effects, and therefore it will feel a little bit stingy. But I would say that most patients who, on a sort of ouch scale, of 0 to 10, I know that video was talking about it, but probably say about a 6, 7. They're fine, and it certainly never prevents people from coming back and having it done again. And it's also your techniques. I've seen the way you all do it, and actually there are very clever ways you guys do it to actually make it a very, very comfortable procedure. And again, we go back to its experience and your technique that makes the patient feel it's very easy. So I think that's very important to say. Next slide, please. Okay, so this is one that Tara touched on earlier. We're going to go through these questions at a pace now because we've got a lot to answer. Can you have all therapy whilst having other treatments? I'm going to ask each and every one of you this question. Tara, do you want to start this one off?
Yes, well, as we know, the way we age isn't all about skin laxity. So it's a bit of bone reabsorption, it's fat repositioning, and it's skin that's getting looser, the collagen and elastin. So yes, we do use toxins to target some of the muscles that are pulling down the face and in the forehead. We use a lot of skin boosters to hydrate the skin. Filler to give you a little bit of support if you need that support, the dermal fillers there just to give you a little bit of support, and lots of medical grade skincare. So yeah, of course, the most natural look is a combination of all these treatments, and that way you keep that natural look.
Yeah, yes. And Sylvia, would you concur with that? Would you agree?
Absolutely. I wanted to add that there were actually studies done by Dr. Gabriela Casabona, and she has combined the treatment of dermal fillers and Ultherapy, and she concluded that there were actually increase on the thickness of dermis by 23% when she combined those two treatments together. In comparison to having the treatment in separation. So yes, agreed.
Yeah, and Lee?
So for people that are considering the treatment, I would always say that have your Ultherapy first and then have your dermal fillers and your toxin afterwards.
Yeah, good point. And I think I always say, you know me, I love my little anecdotes and my little sayings of patients because I think it makes it very, people can really make their own decisions then based on, very transparent discussion. But I think that, we say it's a bit like when we combine treatments, as you've all said, in the best possible way, not overdoing it, just enough, but not too much, you get a much more natural, balanced look, which is literally, people can't tell. It's when people rely on too much of one thing, too much filler, too much toxin, too much this, and it's all one thing, it looks just unbalanced. When we use regenerative treatments like Ultherapy with very clever strategic filler, with very clever sort of skin boosting treatments to hydrate and stimulate, you get the most superb aesthetic results, which are frankly extraordinarily high quality. So that's the kind of mantra that we will have at the clinic, which is what patients want nowadays. They want sophisticated high quality treatment. Next slide, please. And this just demonstrates that, the before and after, the heart-shaped face has been restored, the jawline is cleaner, the eyes look brighter, that midsection of the face looks more lifted and supported. It's a beautiful, I would argue that most people would think this is a surgical result, and it is not. Next slide, please. And this one shows one of Tara's patients as well. A very nice result. You know this lady well, don't you, Tara?
Yes. So I think I treated this lady quite a long time, about 10 years ago now, was it about 8 years ago? And I'm pleased to say she's still looking really nice and fresh, and that laxity, she just maintains that investment. She's probably in once every 12 to 18 months for the Ultherapy, and then maybe once or twice a year for a little bit of dermal filler support.
Yeah, it's a lovely result, Tara. Next slide, please. Okay, so again, we're gonna really pace it up now. So I'll probably ask just one of you at a time. Somebody's getting married, wanted to know the best time to book for treatment, so she has the optimum results. Lee?
Yep, so if you're thinking of getting married, then definitely plan it. I'd say a good 6 months before your wedding. But just one thing to remember, that this treatment is the treatment that always keeps giving, and results have been seen up to a year.
Yeah, absolutely. Next slide, please. And I think this video shows this very well. This video shows how, as your practitioner performs a treatment, they precisely target the muscle layer and then the upper layers of the skin to cause collagen to remodel. This results in an overall skin lifting and tightening, and the results can be seen as early as weeks and take up to 3 months to become fully apparent. The results then last about a year to 18 months. Okay, so Olivia asked us about aftercare and care beforehand and any preparation. So Sylvia?
In terms of the prepare myself, yes, as we've mentioned before, patients are a little bit anxious before the Ultherapy treatment. So we do ask our patients to arrive like half an hour before. We also, in terms of the preparation at home, there's nothing really preparation at home. We will do everything in the clinic. We will apply anesthetic cream. We will mark the area. We will take pictures before and after as well. But in terms of the patients, there is not really anything that they need to do apart of having a thorough and customized consultation with us, really.
Yeah. So that's the beauty of it. It's not like a laser treatment where we have to really counsel people about they can't have sun exposure before, they can't have sun exposure after, and you've got to be really, and of course we all have to protect our skin and not overexpose to the sun. But with this treatment, it doesn't require that kind of consideration, which again, for a lot of people is a big plus. Next slide, please. So facelifts. People often come in, and Patricia's asked this one and asked us this one, about whether this treatment is suitable for people who've either already had a facelift and just want to maintain it, or before. We see a lot of people, don't we, who are probably going to cross the line and go into a surgical procedure, but certainly don't want to have it yet. So Tara, what do you advise, and how would you roll out an Ultherapy program with these people?
So funny, I had a patient last week, had a lovely surgical result, and we were just discussing, she's feeling a year later that she was just beginning to feel a bit of loosening under here, jawline wasn't so defined. So we've just booked her back in for a maintenance Ultherapy. So yes, we combine it with facelifts. Because you are just aging forward, you will continue to age after your facelift. So if you want to maintain the results, add in an Ultherapy into your treatment plan.
Yeah, to know a lot of surgeons do like, particularly in the States, they do like patients to have been primed with Ultherapy, 2 or 3 times leading up to their facelift. I know that that's very much what's embraced, particularly in the USA. And as you say, to maintain the results long term, it can prevent, because most people don't want to go through a facelift procedure again, but they want to maintain the result. So that's a good thing. Next slide, please. Okay, downtime, side effects, Lee?
No, not much downtime at all, really. When the patients leave the clinic after treatment, they're a little bit red from where the transducers have been going over the skin and where we've cleaned their face. They can have a little bit post-swelling, but that's quite pleasing. But nothing really to worry about.
Yeah. Anybody online here seen anything more significant than that? Anything where, because again, this is a transparent webinar. We want to be very honest with people. I think we'd all agree what sells it to people is it works. Actually, it does have very little, if any, downtime. Has anybody seen anything significant that's really bothered a patient?
Not really, to be honest. Most of the patients are saying that there is a tenderness, or sometimes when they touch straight after, but I would say it's up to 2 or 3 days. There is nothing really long-term in terms of the downtime.
Yeah, I very rarely have seen patients who've had bruising, but that is incredibly rare. I think in our last clinical audit, it was less than 0.5%. It's a very, very low percentage, might have the odd bruise, particularly on the neck, but largely there's no downtime with this treatment, I know, but a bruise goes, it's just one of those things. Next slide, please. Okay, contraindications. Anybody, Tara? I think what we all
anybody pregnant, breastfeeding, pacemakers. That's about it, really. My patients on blood thinners or high blood pressure, being treated for high blood pressure, those patients might get the odd little bruise, but it often is only a yellow bruise about 4 days later, because it's been targeted quite deep. So yeah, that's it really. Very few.
If I can add something, if that's okay, and also any open wounds on the area that we're treating, and also severe cystic acne.
Yes, yes, all those things we take into account. And you know, I think again, considering the kind of effect this procedure has, what never fails to amaze me is that the absolute contraindications to it are minimal, really. And we very rarely have to send people away and say no. I'm always quite surprised at that, but it's true. And normally you can get really nice results in a lot of people. Next slide, please. So I'm going to start this one off because we thought we would also not be frightened of difficult questions here, because we know that unfortunately the internet is a wondrous thing, but the internet as well can be absolute nightmare for us as medical practitioners, not only in the cosmetic arena but in medicine generally, because there's a lot of good stuff out there, a lot of really factual stuff, and then unfortunately there's a lot of confusing stuff that is not accurate. And one of the misconceptions about Ultherapy is that it causes fat loss. Now, to be very clear about this, Ultherapy tightens and lifts using ultrasound, as we've said, to heat tissue, as you saw on the videos, to actually heat the tissue between 60 and 70 degrees, which sounds very, very, very hot, but actually it's what we call a therapeutic level. We have to hit that temperature in order to cause this collagen remodeling and lifting and tightening. It's a very well established way, safe way of lifting and tightening skin. And we use heat sources in many areas of cosmetic medicine, laser technology, radiofrequency technology. We are used to using these things safely. Fat cells are susceptible to temperature change. If we freeze fat cells, we cause fat loss. We use that in our clinic all the time, don't we, by using cool sculpting to reduce fat. And if we heat fat cells, you can cause fat loss. However, if this treatment is done the way we do it and accurately, you will not run the risk of fat loss at all. So it's all about experts treating. And this is why you guys are the UK trainers for Ultherapy. This is why you are proven to do the treatment safely. So can you just elaborate on this, Lee, because you're there, you were answering the last question. How do we avoid fat loss in our treatment?
So again, it goes back to the difference between you know, our device, which is the micro-focused ultrasound, and the HIFU. We can see where we're treating. So we're not shooting the thermocoagulated spots into fat, we're shooting it into the muscle. And these in particular places where we need to lift and tighten. So that's why we know that we're not causing that problem.
Yeah, because we're looking at what we're looking all the time. We're not hitting fat, are we? Anybody want to elaborate on that at all? Or no, happy with that? I mean, it's very straightforward. If we treat well.
It's really straightforward. It's a simple thing. We don't want to get too technical here, but it's something called stacking. So if you consequently put every line of ultrasound on top of each other, there is a possibility. But, you know, with the experience that we have, we just, as Lee says, we can visualize where the fat is and we don't treat it.
Yeah, so we're very happy with that. Next slide, please. Okay, males. So this gentleman was asking a couple of things here. Whether we can treat different skin types, and is, you know, a male, are they suitable? Sylvia, I'll start with you. Very straightforward one, really.
Yes, it's straightforward. The answer is yes. We treat, we've got actually plenty of patients who are male, and we treat male patients. It's not really a difference in terms of how we perform the treatment. We are customizing this to each individual. So yeah, absolutely, male treatment we can perform.
Yeah, we can treat any skin type. And we can, males, as I said earlier, very popular treatment with them, largely because it works very well on them, and there's no downtime. Next slide, please. Lip lines, Tara. I know you're a lip line girl. You love a few lip lines to treat.
At 56, I've got a few lip lines if I hadn't treated and prevented them. Ultherapy, yes, does go some way, and particularly if you are preventing. If lip lines need correcting, they often need a multi-treatment approach. So we possibly put a very, very soft skin booster in there, maybe a tiny bit of toxin, but Ultherapy to stimulate that collagen there.
Yeah, because what we all would know now, and for many years, and we know never to do this, is overfill lips, they give that sort of monkey look, that overfilled look. We use, as you say, that multidisciplinary approach to address these, so you can't see the lip lines, but you don't get that look of having had something done, and that's what Ultherapy brings to the table, which is, again, what people want. Next slide, please. We're getting there now. We're getting there. Jane said, eyes are always a big deal. Like skin, crepiness, hooding. We saw a really good before and after before, where the hooding can be lifted with a brow treatment by contracting the skin here and making it look more bright and fresh. So is Ultherapy safe to use around the eyes? Is it a good treatment for this? I'll ask each of you, do you treat eyes? So Sylvia, I'll pitch off with you, and then each of you can ask, do you treat eyes and do you get good results?
Yes, there is quite important area, and I've got a lot of questions from the patients about the hooded eyes. So there is specific protocol for all the patients who have got any concern. Is it safe or not? It is. It is very safe. We've got specific protocol how to treat around the eyes. And I achieved actually fantastic results with the latest kind of approach that the protocols that we have been learned. Yes.
Yeah, good. Lee?
Yeah, definitely. It's a really nice treatment to use, especially under the lower eyelid, to give that little bit of tightening and brightening around there. Absolutely.
Yeah. And Tara, I know you treat quite a lot of eyes as well.
Yeah, it's actually probably my go-to treatment for skin laxity, lower eye.
Yeah, I mean, you know, it is true. You know, if we look at the cohort of people that come through the doors, the people that come through and what they have done, there's no doubt the majority of people do end up having the whole face done, because, you know, it's a bit like having, you know, colour cut and blow dry rather than just cut and blow dry. You get a much nicer, more balanced, beautiful look. We can still focus on key areas of concern, you know, the main areas, but by doing the whole face, you can get, again, a much more balanced, natural, holistic sort of approach to a face, which, again, a lot of patients are after that, but we can just target key areas if necessary. Next slide, please. I think we're now moving to the end of our questions and answers session. And I think Tess Daly put this so beautifully. You know, it is just about looking like you've got the best skin you've had in a long time, that refreshed, vital, dewy, luminous sort of look, where you don't, you know, we don't want necessarily to be plastering a lot of makeup on our faces to try and hide or correct certain things. We want to sort of feel that we've got our best skin we can have. And I think Ultherapy is so age appropriate. It's not going to give overlifted looks. It's not going to give distorted looks. It's going to give balanced, regenerative treatment. And that's where it's at the moment. And I think that's what a lot of our patients, as I keep saying today, are after. Next slide, please. I think this is our last slide. This is just telling us that, you know, the best way to find out at the end of the day whether you are suitable for an Ultherapy treatment is to come into clinic and have a complimentary consultation. Let one of our specialists take a look. Our specialists work in both all our sites. They will be able to honestly discuss with you whether Ultherapy is for you and what it's likely to deliver. I want to thank you all for your expertise. We've just literally skimmed the surface of Ultherapy. We've just literally selected a few questions. As I said to those people watching the webinar, if you want to see our previous webinar on Ultherapy, where we discussed the technology in much more detail, or you've got more questions, ring us, ask us. We'll be able to provide you with the information. So it just leaves me to thank you. Thank you, Tara, Sylvia, Lee, for your expertise. I think we are very lucky to have you in clinic with your years of experience, and you've all developed, as I said, your unique ways of assessing and treating patients to give them the very best they can get. So thank you for attending the webinar, and we hope to see you all in clinic very soon.